A disease-modifying anti-rheumatic drug known as DMARD reduces the progression of tissue destruction of the inflammatory disease process, especially rheumatoid arthritis, by inhibiting tumor necrosis factor, known as TNF. DMARDs are prescribed primarily by specialists to prevent or limit bone destruction, and they are used only in diagnosed cases of rheumatoid arthritis or another chronic inflammatory disorder that has been getting worse despite other types of treatment. You need to know about these drugs because none of these agents is without significant risk and toxic effects. Patients taking these drugs need constant follow-up and regular evaluation, and they may be admitted to the hospital or seen in offices for other problems. DMARDs are used to treat many types of chronic inflammatory disorders that involve severe tissue destruction caused by excessive amounts of TNF, in addition to rheumatoid arthritis. Other autoimmune disorders that respond to DMARDs include ankylosing spondylitis, psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis. DMARDs work through a variety of actions to decrease or suppress the inflammatory response, and in cases of rheumatoid arthritis, slow down the progression of disease and preserve joint function. The most commonly used DMARDs inhibit the inflammatory mediators TNF. They do this by binding to the TNF molecules, reduce the white blood cells, which keeps them from binding to TNF receptor sites on inflammatory cells and other cells. This prevents the cells with TNF receptors from continuing to produce more TNF and other substances that enhance the inflammatory response and cause direct tissue destruction. As a result, pain is relieved, physical function improves, and tissue damage is reduced and delayed. Most DMARDs are given by injection, although there are a few oral formulations as well. The most two common DMARDs are adalimumab and etanercept. Adalimumab is known as Humira, and etanercept is known as Enbrel. The nursing implications involve informing the patients that the injection site reactions include causing redness, pain, swelling, and itchiness that may occur but typically subside within a few days. Rotating the injection sites on the front of the thighs and the abdomen to ensure best absorption and prevent skin problems. Avoid giving within 2 inches of the umbilicus because this area may contain many blood vessels and absorb could be very rapid. Do not shake the vial, pre-filled pen, or pre-filled syringe because shaking may damage the drug. Do not rub the site after giving the injection to prevent bleeding and bruising at the site. For patients with psoriasis, make sure not to inject in any lesion because drug absorption is delayed in these areas and the lesion may mask skin reaction to the drug. Do not administer these drugs to patients with an active infection, including local infections, because the drug reduces the immune response and can make infections worse. Make sure the patient reports any signs of infection to the healthcare provider immediately because the drugs reduce the immune response and could make the infection even worse. Patients who take these drugs before surgery may have greater risk of infection post-operatively because the drug has the ability to reduce the immune response. Patients may need to undergo testing for tuberculosis infection before starting therapy to prevent reactivation of the disease or worsening of existing disease. If latent TB is persistent, the patient may need to undergo TB treatment. Monitor patients carefully for any symptoms of allergic reaction so that interventions can begin quickly. Instruct patients to avoid vaccination of live viruses while taking DMARDs. The vaccination may not fully be effective because of reduced immune response. Make sure the patient understands it is not unusual to experience a mild headache while taking these drugs so that they will not be alarmed by this type of side effect. The most common side effect from the injected DMARD is a reaction at the injection site. Reactions include pain, swelling, itching, and redness at the site for about 1 week. Many patients also have headache and nausea. Because these drugs reduce bone marrow production of red blood cells and platelets, patients may develop anemia and have an increased risk for bleeding. Severe adverse reactions are possible and relatively common in patients taking DMARDs. It is important to monitor patients carefully and teach patients the symptoms to report. All DMARDs reduce the patient's immune response to some degree, increasing their risk to infection. Patients who have had tuberculosis or a viral infection such as shingles or hepatitis in the past are at high risk for reactivation of the old infection. Although reduced immunity is an expected result of therapy with DMARDs, it is considered an adverse reaction that must be monitored for severity. If reduced immunity is severe enough or severe infection develops, DMARD therapy must be stopped. DMARDs can cause heart failure that may be new or more severe while taking the drug. DMARDs should not be given to anyone who has had severe heart failure. Patients taking injectable DMARDs may be at higher risk for allergic reaction, even anaphylaxis. Because of these solutions may contain some animal proteins, fortunately these reactions are not common. If the patient is taking any other type of drug that reduces immunity, taking a DMARD will make immunosuppression more severe, greatly increasing the risk of infection. It is not recommended to give 2 types of DMARDs that interfere with TNF at the same time. Some immunizations contain live vaccines. For the patient receiving DMARDs, live vaccination or immunizations are avoided because the patient may develop the disease that the immunization is supposed to be preventing. Because DMARDs reduce immunity, the patient may not have the accurate response to tuberculosis testing with the purified protein derivative, also known as a PPD. The response may be negative even if the person has active tuberculosis. Before giving a DMARD, ask the patient to list every drug he or she is currently taking. Ask about symptoms of infection, fever, cough, foul-smelling drainage, pain or burning on urination, general malaise, or any recent exposure to people who have been ill. Ask whether the patient has received any vaccination or immunization within the past month. All patients must be tested for tuberculosis before starting DMARDs. The first dose of an injectable DMARD must be given by a physician or a registered nurse in a setting that can handle severe allergic reactions. It cannot be started in an extended care facility or in the home. Take the patient's vital signs, especially pulse and blood pressure and oxygen saturation, before giving that first dose. Use this information as a baseline to assess for an adverse drug reaction. Keep an emergency cart close to the patient during the first injection and for the first 2 hours afterwards. After the first dose is given, observe the patient every 15 minutes for any type of allergic or adverse reaction for at least 2 hours. These observations include respiratory rate, ease of respirations, blood pressure, pulse oximetry, rash or hives at the injection site. After the first therapeutic dose is given and no adverse reactions have occurred, the LPN can administer subsequent doses. Some patients can be taught to self-inject subcutaneous doses. Carefully read the specific directions for administration of the drug before giving them. For example, adalimumab should not be shaken before giving it because damage to the drug may occur. The drug can be left at room temperature for 15 to 30 minutes before injecting, but the cap or cover must be left on the drug bottle while allowing it to warm to room temperature. Check for and report signs and symptoms of infection: fever, cough, malaise, foul smelling drainage, pain or burning on urination to the healthcare provider immediately. Teach the patient how to inject themselves and obtain a return demonstration of proper techniques for self-injection before discharge to ensure proper drug delivery. Make sure the patient understands to report any nausea, vomiting, loss of appetite, severe fatigue, or changes in color of the urine because these may be symptoms of problems with the liver. Make sure the patient understands not to take any over-the-counter drugs without contacting the healthcare provider to avoid dangerous drug interactions.